Stand by SOT1.
Standing.
10 seconds. Ready, rolling. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters. It is January 28th, 12 noon straight up. Welcome to another edition of Work Comp Matters. We, of course, are sponsored by mancavepodcasting.com. We've got over 600 podcasts in the cloud. They're completely free, no obligation, available to you 24/7. And if you want to do your own podcast, 818-357-4120. We will produce, stream, direct, get it into the cloud, all for only one low fee. Good afternoon, everybody. My name's Steve Appel. I'm joined by the madman across the water, a.k.a. the socialist voice of reason, out in Munich, Germany, Mr. John Scalia. These are your headlines for January 28th. California nursing homes, Omicron is bad, but so is isolation. Generous deals and a few unwanted surprises had covered California. San Francisco ramps its indoor mask mandate. Halted disability claims were mostly scams, California says. Los Angeles County Omicron surge has peaked, experts say, but mortality still high. The good, bad, and the ugly from Santa Cruz County COVID dashboard update yields new discoveries. In Bakersfield, Kern County reaches a green milestone, 2,000 COVID deaths. Omicron was in California before it was named Omicron, according to sewage samples. Omicron subvariant in California, what to know in Sacramento. What are poop, more sewage is telling us about the Omicron surge. Those stories and more poop on Work Comp Matters. Well, we are coming to the end of January. I hope all of you are enjoying the new normal. I certainly am. And look forward to more news, stories, information, and hopefully some answers that John and I believe interest you California employees, employers, and of course, we haven't forgotten about you damn independent contractors. I'm going to take the first story. Omicron infections are surging in residential care facilities, causing massive sickouts among staff members and an uptick in hospitalizations and deaths. The latest visitor restrictions and testing requirements are also compounding the isolation that residents have suffered for almost 2 years. John.
California says most halted disability claims are fraudulent. After suspending 345,000 disability checks because of fraud concerns, California officials on Thursday said nearly all of those claims were associated with criminals trying to trick the state into paying them. The EDD, Employment Development Department, announced this month that they had halted payments on those 345,000 claims associated with 27,000 suspicious doctors. On Thursday, the department announced that it had verified the identity of just 485 of those doctors, meaning about 98% of the claims are likely fraudulent. The few providers that were not fraud, but instead victims of identity theft, are completing verification along with their patients to then resume certifying claims, the department said in a news release. The department said most of the state's disability claims were unaffected by the scam, as the state continues to pay about $150 million in benefits each week. But it said a small number of legitimate claimants have had their payments frozen. The EDD has been plagued by fraud since the start of the COVID-19 pandemic. Now, again, my observation is, the last time I heard, California was the home of Silicon Valley, which has all the tech geniuses in the world. So what kind of computer program, how many decades behind is EDD that they have to do something like this? That they have to stop paying on 345,000 checks in order to do something which apparently they should have been able to do in the beginning. So I don't get it. Steve.
Yeah, John, there's no question about it that the state's computer system is literally decades old. If I'm not mistaken, they were provided millions of dollars, or maybe that was the DMV, the Department of Motor Vehicles. I don't know. And you're right. We're in the home of Silicon Valley, and we last year the story was out about $30 billion in unemployment and disability. People who were in jail, people who were dead, were getting checks. Christ, Scott Peterson actually got a check. Okay, so yeah, no, absolutely correct. Speaking of up north, San Francisco revamps its indoor mask mandate. San Francisco will lift indoor mask requirements Tuesday for offices, gyms, and other places where stable groups of vaccinated people gather. This time, everyone in those settings must also have received booster shots if eligible to go maskless. Okay, so apparently the mandatory mask mandate in San Francisco at those locations, gyms, offices, etc. They're removing the mask mandate, but now not only do you have to have a vax passport, you have to be able to prove that you're boosted, even though the most recent reports indicate that boosting provides little to no help against the Omicron variant. And John, I'm going to tell you one of the main reasons why, which they're not talking about in the news media, but this is the truth. And you and I have discussed this. We've gone circles around this many, many times. And that is what's in the booster. How much of the booster is of the original jab? And the consensus appears to be, correct me if I'm wrong, that the booster is exactly the same ingredients as the original jab. It's just about a half dose. Now, presuming that's true, the original jab was designed specifically for the original COVID. Let's call it COVID A. It was not made for either the Delta variant and certainly not the Omicron variant, which is the main factor, a contributing factor, why the boosters basically don't help against Omicron. Go ahead, John.
Well, that's interesting because actually my booster shot was different from my first two shots. My booster shot was one of the mRNA variety. I forget.
You had AstraZeneca though, right?
For my first two.
Yes.
My booster was mRNA. It was from Moderna.
Oh, it was from Moderna. Okay, gotcha.
So I don't know. What you just said makes a lot of sense, but I don't know if it applies to people who had a mix of the two shots, because my booster shot was actually the Moderna. I mean, it was funny because when I went there to get my booster, I thought I would rather have the mRNA, but I figured, yeah, I'll stick with what I got. So I checked the box that said, AstraZeneca, and I went into the little cubicle to get my shot, and the doctor looked at it. He said, "No, we don't have that. You can't get AstraZeneca. We don't have it. You're getting Moderna. So I'll check the box for you."
and of course, since the start through today, AstraZeneca is not approved in the United States.
Well, yeah, that's interesting because I've had one Moderna, so but I don't know if that would affect me if I tried to come back right now, since I'm an American passport holder.
Yeah, exactly. You've got the next story, John.
Okay, Omicron was in California before it was named Omicron, according to sewage samples. Okay, we're back here. I don't know if you guys remember, but I previously read a story about the health authorities checking sewage and determining whether or not Omicron was present by doing a chemical analysis after they did all sorts of sanitary stuff to the gunk. We've learned a lot about COVID-19 by examining what we've flushed down the toilet. Here are a few of them. The variant was in a waste sample collected in Merced County on November 25. That's a day.
You're shitting me.
That's a day before the World Health Organization named it Omicron. Scientists in New York found it in a sample collected even earlier on November 21, predating the alarms from leaders in South Africa about a troubling new variant. Officials in Texas also detected Omicron early through wastewater surveillance. A new report last week from the Centers for Disease Control and Prevention outlined these facts. Agency scientists described this as, quote, strong early evidence that the Omicron variant was likely present or more widely distributed in these communities than originally indicated by clinical testing alone.
That's crap.
The report makes the case that by the time officials have detected a new variant, it likely has spread to numerous other countries. So they're talking about the fact that, banning people from flying in from areas is probably useless. You're better off testing them before they get on the plane.
Yeah, I'm gonna poo-poo that, John. Sorry about that. I can't help myself. Los Angeles County is on the downslope of the Omicron winter surge. The county's public health chief said Thursday, January 27th, but with 85 more deaths related to the virus posted, she warned of complacency as the region turns the corner into a near future that, while hopeful, remains vulnerable to variants and continued high transmission. John.
This is from the LA Times. California settlement limits ICE from redetaining immigrants freed because of COVID. Immigration authorities must preserve coronavirus safety measures that allow for social distancing and vaccination mandates for staff and detainees at 2 California detention facilities, according to a class action lawsuit settlement reached Thursday. The settlement also limits the authority of U.S. Immigration and Customs Enforcement, otherwise known by their lovely acronym ICE, to redetain hundreds of immigrants who were released as a result of the lawsuit. The ACLU and other groups filed a lawsuit in April 2020, in the early days of the COVID-19 pandemic, to challenge unsafe conditions at the Mesa Verde ICE processing facility in Bakersfield and the Yuba County Jail north of Sacramento. Now, I got to tell you, these facilities, at least one of them, if not both, are privately run. And you've already heard my rants about how it is just an abdication of law enforcement and state responsibility to say we're going to detain people and we're just going to have it done by private enterprise. If the state wants to do it, the state should be responsible for housing them and their care. But obviously, that's not what's happening. When we filed this lawsuit, ICE had put our clients and communities at risk by detaining as many people as possible in filthy, crowded dorms and cells, creating a tinderbox for COVID-19. Bree Bernwanger of the Lawyers Committee for Civil Rights of the SF Bay Area said in a statement, as the coronavirus spread, advocates filed similar lawsuits for other detention facilities around the country. The settlement comes as coronavirus infections in detention centers have surged since December to 3,129, nearly 15% of the total detained population. As of Wednesday, 11 people in ICE custody have died, according to the agency. That goes on. And when basically what the order says, okay, if you release these people, you can't put them back in detention, which essentially are glorified prisons. And again, privately run facilities have no business. And I must say, California has outlawed having private jails. I forget when that takes effect, but that legislation was passed by the California Assembly, and California will no longer be using private jails for inmates. Steve.
You're dialed into Work Comp Matters. We're sponsored by mancavepodcasting.com. We've got over 6 podcasts in the cloud available to you 24/7, no obligation. They're completely free If you want to do your own podcast, 818-357-4120, and we will produce, direct, manage, get that sucker streamed live and in the cloud forever. Back to our news that affects you California employees, employers, and independent contractors. From the Bakersfield Californian, Kern County reached a grim milestone yesterday. More than 2,000 of its residents have died of COVID-19 since the start of the pandemic. Kern County Public Health announced 17 new COVID deaths yesterday, bringing the tally of COVID deaths in Kern County to 2005. The milestone comes as the county is still tallying numbers from 2021, which also marks the year that the first 2 children in Kern County died of COVID. John?
Okay, the following article comes from one of my favorite federal agency, and I'm not being sarcastic, it really is my favorite federal agency. It used to be called the Office of Budget Management or Management Budget. I think it's OBM or OMB. Now it's called the Government Accounting Office. And they are nonpartisan, okay? They don't care who is in power, and they don't care who is screwing up. They just call it as they see it. My favorite instance from their nonpartisanship came after the Vietnam War, because one of the things they're in charge of doing is making sure that what the federal government says, including the military, is accurate. So when the military says, well, we lost, 500 planes in Vietnam, they're in charge of verifying that claim. And unlike a lot of people who would say, okay, we're just going to accept whatever's put in front of us in a report. No, they go out and count. And after the Vietnam War, it turned out that the military had underreported like 1,000 planes going down. And, because they went out and they counted, they said, wait a minute, where are all these planes? You said you only lost so many. So we're the ones that are supposed to be here. So that's what they do. They don't care who's in power. So this is about them. Now, this is the article head is Watchdog says key federal health agency is failing on crises. The government's main health agency is failing to meet its responsibilities for leading the national response to public health emergencies, including the coronavirus pandemic, extreme weather disasters, and even potential bioterrorist attacks, a federal watchdog said Thursday. The Nonpartisan Government Accountability Office said it is designating the Health and Human Services Department's leadership and coordination of public health emergencies as a high-risk area for the government. While that designation carries no immediate penalties, it signals to Congress that lawmakers need to pay special attention to the agency's operations. Longstanding, quote, persistent deficiencies, close quote, at HHS, quote, have hindered the nation's response to the current COVID-19 pandemic and a variety of past threats, the GAO said in its report. If left unaddressed, these deficiencies will continue to hamper the nation's ability to be prepared for and effectively respond to future threats. The shortfalls include managing the medical supply chain, coordinating with federal and state agencies, and providing clear and consistent communication to the public and the healthcare community, the GAO said. The report is part of the GAO's evaluation of the government's pandemic response. It was released as senators of both parties came out with draft legislation this week calling for a close study of the pandemic and an overhaul of HHS capabilities. Among the lawmakers, it goes on. Anyway, this is bipartisan, which is not only is the committee bipartisan, but one of the bills that was introduced as a result of this was introduced by a Democrat and a Republican, which is one of the rare instances of cooperation on Capitol Hill these days. But as I said, this agency is totally nonpartisan. They don't care whose ox they're goring. They just look at the numbers and they verify the numbers and they reach conclusions based on the evidence. How refreshing. Steve.
The coronavirus pandemic is in another bout of deja vu, as the World Health Organization warned people this week that a sub-variant of Omicron is spreading across the world, dubbed BA2. The subvariant is not a variant of concern, the World Health Organization said, but has been traveling in Denmark, India, and the United Kingdom, and now it's in California. Yeah, my understanding as of last week is that it's been found in 40 different countries, and now it's here in California. But according to who, it's not a concern. John.
Well, the following is not one of the articles that I listed and told Steve I was going to do, but I just want to comment on it. And it comes from the BBC. And that is that you all remember the old brouhaha about Novak Djokovic trying to get into Australia with his so-called visa and his so-called certificate that he had COVID and he'd recovered from it, all right? And you may recall at the time that I expressed skepticism, to put it politely and mildly, about COVID, about Djokovic's documents, pointing out that he was a national hero, that he would get anybody in Serbia to do anything he wanted, and that, based on Steve and my personal experience, we know you can get medical groups to say whatever you want, depending on, not everyone, but some of them, to say whatever you want. Well, the BBC, it was actually a study done by Der Spiegel, which is a German news magazine, and they took the documents that had become public of what Djokovic submitted to the Australian authorities, his COVID certificates, right? And they looked at it, and of course, they're government documents from Serbia, which isn't much of a country; it's kind of a rogue nation. But it's Serbian government documents. Now they have numbers on them, all right? So Der Spiegel got a team together, and they said, "Do these numbers make sense in terms of when Djokovic said he got the notification and and how the documents are dated?" So they went back and they pulled the numbers that were being issued during the COVID crisis in Serbia. And guess what? The numbers on the documents that he gave to the Australian authorities are bogus. The numbers are out of line. They're all issued consecutively, and the numbers on his so-called documents were not issued at the time that the dates on the documents say they were. In other words, they're fake. And again, if Djokovic tries to say, well, it was one of my staff that did it. Come on. He knows that he didn't get nobody ever gave him that notification because it didn't exist, which would also explain why the press had pictures of him posing appearing in public without a mask, because nobody told him he had COVID because he never gets tested. And so once again, and of course, my criticism of the Australians were that they didn't go into the medical evidence. They went to the Australian Supreme Court and they said, the only thing we're going to be concerned about is whether he's a health hazard, according to the Minister of Immigration. Does he have the right to say that? So basically, he was punished for his stance on vaccination instead of being punished for what he should have, which is giving false documents to gain entry into Australia. Steve.
California is on the downslope of yet another coronavirus surge as it enters another season of celebration. Numerous family gatherings and community events are scheduled to mark the Lunar New Year next week, and the Los Angeles Rams and the San Francisco 49ers will duke it out at SoFi Stadium on Sunday with a trip to the Super Bowl, which, by the way, is also at SoFi Stadium. Scheduled in Inglewood 2 weeks later. On the line. But as California's experience illustrates all too clearly, celebration without caution could wind up prolonging a pandemic already set to enter its third year. Well, they've already had 8 games at SoFi Stadium. They pack in 50 to 70,000 people. This year's Super Bowl will be at SoFi Stadium. I believe they're going to pack in close to 100,000. Don't quote me. And I also read, got wind of somewhere that everybody that attends the Super Bowl is going to be given a free N95 mask. Now, the question is, how many of them will be wearing it? John.
Okay, this is from Cal Matters. What's in the California paid sick leave deal for workers and businesses? California workers will soon again have access to as much as 2 weeks paid time off for COVID-related sick leave under a deal announced Thursday by the governor and legislative leaders. The agreement comes amid the continued Omicron surge and the resulting labor shortage across the state's workforce, including healthcare, schools, and public transit. And it may be just in time. The number of Californians who are not working in the last month because they or a family member had COVID-19 increased by 320%, according to a California Budget and Policy Center analysis of census data. California workers have been without extra paid time off for COVID, on top of just 3 days of regular paid sick leave, since the statewide program ended September 30. But the pandemic has peaked again since then, and labor groups and advocates have been lobbying for months to restore it. Under the deal negotiated by Governor Gavin Newsom, Senate President Pro Tem Tony Atkins, and Assembly Speaker Anthony Rondon, the new leave program will be retroactive to January 1 and extend through September 30. Steve.
Up and down California, the contagious Omicron variant of the coronavirus has shaken the state's labor market. Hospitals are understaffed, schools are low on teachers and substitutes, and law enforcement officers and first responders, whoever the hell a first responder is this day, who are increasingly exposed to risky one-on-one contacts and super spreader events, are having to make do with fewer people. Since the surge began in December, law enforcement agencies have been forced to increase overtime, reduce services, and reroute non-emergency calls to online portals, according to Cal Matters survey of more than 30 California agencies statewide. John.
For the LA Times, for many COVID-19 vaccine opponents, no jab means no job. For 8 years, Mike Miller has patrolled the grounds of the Snake River Correctional Institution, a medium security prison in East Oregon. His $74,000 salary has paid for his home across the state line in Boise, Idaho, and allowed his family to homeschool their 3 kids. Now, I'm going to editorialize here. The guy is working in Oregon. He lives in Boise. Why? Because Boise is a really right-wing area. It's full of very conservative people, lots of Mormons. So obviously he wants to live in an area as opposed to living in Oregon, which is contrary-wise very liberal. But next week, he'll face his bosses at a, quote, pre-dismissal hearing for violating the terms of his job. Miller expects to be fired for refusing the COVID-19 vaccine. The vaccines probably do work for a lot of people, said Miller, 38, a self-described born-again Christian who rejects the shots because cell lines derived from fetuses aborted decades ago were used in their development. Our religious convictions tell us that abortion is wrong. We cannot use these vaccines. He added it would be easier to just get a shot, but I cannot stand for them forcing me. Even as the nation approaches the 3rd year of the pandemic, a defiant 24% of the population has received no vaccine shots at all. So there you have it, another religious fanatic saying, I don't want, by the way, the mainstream religion that is most consistently opposed to abortion, completely opposed to it, and has lobbied against any liberalization of abortion reform in countries around the world, the Catholic Church, has actually come out and said that, there's no contraindication because of the use of certain stem cells in developing the vaccine. There's no contraindication for Catholics who hate abortion to use the vaccine. So, this guy apparently knows more theology, which is why he's obviously working as a security guard, because he's a genius. Steve.
John, that is our last official story. Closing thoughts, burning desires.
Yeah, it seems to me that what Novak Djokovic did probably is a criminal offense. I mean, I can't imagine that if you or I tried to get into a country with fake documents, that would not be a criminal offense. But of course, nothing's going to happen to him. And because there are places in the world that only care about money, Dubai has already said he's going to play in a tournament there because Dubai is all about making money, even though they're under Sharia law. So they're not just all about making money. And they've been put on the US government's list of unsafe places now that there was a missile attack in Dubai. Okay, Steve.
And that'll about do it. I want to thank you all very much for joining this edition of Work Comp Matters. Much thanks to Scott Walton, legendary Uncle Studio, John Scalia out in Munich, Germany, all the good people back at mancavepodcasting.com. My name, of course, is Steve Appel. We'll see you again Monday, 12 noon live for another edition of Work Comp Matters. Go Rams!